Okay, so I want to talk to you about a simplified model that I use conceptually to understand the physiology of the respiratory system and helps me um, diagnose different physiological processes in patients who are intubated on mechanical ventilation. I call it the straw and the balloon model. So I want you to think of the respiratory system as a straw and a balloon. And again, this is a very simplified conceptual model, but I think it's very helpful. So the airways in this model represent the straw, and the alveoli represent the balloon. So think of a balloon connected through a straw, and you want to inflate the balloon by pushing air through the straw. So again, using this model, we can understand different processes that patients have. And so when you connect the patient to the mechanical ventilator, the mechanical ventilator is going to deliver pressure to push air into the patient's lungs. And so the pressure is used to overcome two things. First, that pressure is going to be used to overcome the resistance of the airways, and second, that pressure is going to be needed to overcome the elastance of the alveoli. And so if you have a patient on mechanical ventilation with increased airway pressures, then things in terms of conceptual differential diagnosis of two phenomenon. First, this patient can have a very tight airways or a narrow straw. So that's the left case scenario. So think of your patient with an asthma exacerbation. That patient will have increased airway pressures, and those pressures are going to be needed to overcome the resistance of the airways. So think of pushing air through a narrow straw. It's going to need more pressure or more effort on your part to push that air through a narrow straw. The second reason where your patient may end up with increased airway pressures is if the patient has very stiff lungs. So think a stiff balloon or ARDS. And so that pressure is going to be needed to overcome the elastance of the alveoli. So if you've got a stiff balloon, you're going to need to push air using more pressure to achieve the same volume. And so again, with increased airway pressures, think of a narrow straw, asthma, or a stiff balloon, ARDS. And I will go through simulation scenarios in the next video. Thank you.